प्यारे केमिस्ट वॉरियर्स, वॉरियर्स या यू आर वॉरियर्स, आप सब, हम सब इस कोरोना के प्रति छेड़े गए जंग के वॉरियर हो, योद्धा हो। डॉक्टर्स, nurses, the entire paramedical staff, including you, all are frontline workers in this war against corona, COVID-19. As a pharmacist, प्रिस्क्रिप्शन देख के दवाई देने तक आपका कार्य सीमित नहीं है, ये मैं जानता हूँ, हम सब जानते हैं। बल्कि रुग्ण की सेवा और रुग्ण के रिश्तेदारों को आरोग्य विषय की जानकारी प्रदान करने में हेल्थ केयर सिस्टम के आप एक महत्वपूर्ण अंग हो। इसीलिए आईएमए की तरफ से ये कोरोना के विषय अहम जानकारी देने का कार्य मैं आज करने जा रहा हूं। मैं डॉक्टर राजेंद्र कुलकर्णी, चाइल्ड स्पेशलिस्ट हूँ, महाराष्ट्र के नासिक शहर में प्रैक्टिस करता हूँ। दोस्तों, आज के इस लेक्चर में मैं जो जानकारी देने जा रहा हूँ वो 4 महत्वपूर्ण मुद्दों पर है। पहला है कोरोना की पूरी वैज्ञानिक जानकारी। दूसरा है द एंटायर इंफॉर्मेशन लाइक डूज एंड डोंट्स व्हिच यू शुड नो एज अ फ्रंटलाइन वर्कर। तीसरी बात है एज अ फार्मासिस्ट व्हाट ऑल प्रिकॉशंस यू शुड टेक, एंड आपके शॉप पे आप क्या प्रिकॉशन लेना है। लेट मी बिगिन विथ अ मेंशन that our Indian Medical Association Maharashtra State is working closely with your association as well. हमारे महाराष्ट्र स्टेट के प्रेसिडेंट डॉक्टर अविनाश बोंडवे जी सर ने आपके केमिस्ट और ड्रगिस्ट एसोसिएशन के प्रेसिडेंट से बहुत शुरुआत में, जब ये कोरोना की बीमारी इंडिया में आ ही चुकी थी, तब मुलाकात की और उन्होंने जो निर्देश दिए थे उनमें से एक महत्वपूर्ण निर्देश मैं आज फिर से दोहराना चाहता हूं। वो ये था कि यदि कोई मरीज या उसका रिश्तेदार सर्दी, बुखार, जुकाम, मामूली सी खांसी, ऐसी लिए बीमारी के लिए, ऐसे लक्षण के लिए, ऐसी तकलीफ के लिए आपके काउंटर पे आता है और कुछ दवाई मांगता है जो अक्सर ओवर द काउंटर प्रोडक्ट कहलाई जाती है, वो उन्हें मत देना। बल्कि आईएमए ने हर जगह पे फीवर क्लिनिक, फ्लू क्लिनिक, रेस्पिरेटरी क्लिनिक, ऐसे नाम पे जो क्लिनिक चालू किए हैं वहां उन्हें भेज देना, ताकि हम एक भी कोरोना के केस मिस नहीं करेंगे। दोस्तों, ये कोरोना और कोविड-19 इसमें क्या फर्क है? ये Let us talk about this disease first. और ये फर्क यही मैं आपको एक कहानी के तौर पे बताने जा रहा हूं। हुआ यूं कि नवंबर 2019 में, एंड ऑफ नवंबर में, चाइना के वुहान प्रांत में अचानक से न्यूमोनिया जैसी बीमारी से कई मरीज स्वर्गवासी होने लगे। अचानक से वो प्रमाण बहुत ज्यादा बढ़ गया। तो कुछ छानबीन के बाद में ये पता चला कि वो सभी लोगों ने हुबेनन फिश मार्केट के यहां से सामिश आहार किया था। फिर वो मार्केट बंद कर दी गई। फिर भी ये बीमारी फैलती रही, बढ़ती रही। तो फिर उसका डिटेल इन्वेस्टिगेशन के बाद में ये पता चला कि इससे, ये न्यूमोनिया से जो पेशेंट जा रहे हैं, स्वर्गवासी हो रहे हैं, बीमार हो रहे हैं, उनको ये बीमारी की जड़ एक वायरस है जिसका नाम है नोवेल कोरोना वायरस 2। फिर ये बीमारी चाइना के बाहर स्पेन, ईरान, इटली, फ्रांस, जर्मनी, यूएसए हर जगह फैलने लगी। चाइना ने ये बात फिर WHO को, दैट इज वर्ल्ड हेल्थ ऑर्गेनाइजेशन को इंटीमेट की। फिर ये स्प्रेड देख के, कंसिडरिंग दिस वर्ल्ड वाइड इंटरकॉन्टिनेंटल स्प्रेड ऑफ दिस डिसीज, WHO, दैट इज वर्ल्ड हेल्थ ऑर्गेनाइजेशन, डिक्लेयर इट एज एन हेल्थ इमरजेंसी of international concern on 30th of January this year. And friends, this disease caused by coronavirus was named, because it is new disease, entirely new disease, was named by WHO as coronavirus infectious disease of 2019. The abbreviation is COVID-19, COVID-19. इसके लक्षण क्या है? So आपको एक बात पता चल कि COVID-19 is a disease and corona is the virus which is causing the disease. Fine? Okay. So इसके लक्षण क्या है? इसके लक्षण आमतौर पर हर फ्लू के जैसे है. बुखार है, सर्दी आती है, जुकाम आता है, सूखी खांसी आती है, कभी कभी सांस लेने में दिक्कत होती है, और इसके बाद में कई पेशेंट एकदम से सीरियस हो जाते हैं और उनको जान का भी खतरा हो सकता है. लेकिन कहने का मतलब यह है कि ये जो बीमारी है इतनी खतरनाक है, क्या इसका कुछ इलाज है? दुर्भाग्यवश नहीं. हाँ, आपके थ्रोट के सिक्रेशन को टेस्ट करके उनमें से ये विषाणु देख के उसका डायग्नोसिस शिफ्ट किया जा सकता है, लेकिन ट्रीटमेंट कुछ नहीं है. आपको पता होगा दोस्तों कि कुछ साल पहले सार्स, इबोला वायरस, स्वाइन फ्लू, मर्स, दैट इज मिडिल ईस्ट रेस्पिरेटरी सिंसिटिव वायरस, ऐसी भी बीमारियों की वैश्विक महामारियां आई थी. लेकिन आज कोरोना के बारे में जितना कुछ हंगामा हो रहा है, जितना कुछ शोर हो रहा है, उतना क्यों? उतना उनके बारे में नहीं था. ऐसा क्यों? क्योंकि ये बीमारी का फैलाव जो गति से होता है, स्प्रेड जितनी स्पीड से होता है, वो बहुत ज्यादा है. कैसे होता है स्प्रेड? इट इज कॉल्ड एज ड्रॉपलेट ट्रांसमिशन. Means when a patient of COVID-19 when coughs or sneezes, the secretions which are expelled from his mouth, his nose, the virus is there which gets embedded into that secretion, becomes a drops on a surface around. It stays on that surface, and whosoever comes in the contact of that surface can take that virus along and get infection. इस ट्रांसमिशन को रोकने के लिए मेरे दोस्तों 4 चीजें ध्यान में रखिए. एक, हैंड वॉशिंग. सेकंड, सोशल डिस्टेंसिंग. थर्ड इज फेस मास्क एंड फोर्थ इज ग्लोव्स. समझे? हैंड वॉशिंग, सोशल डिस्टेंसिंग, फेस मास्क एंड हैंड ग्लोव्स. हैंड वॉशिंग, फ्रीक्वेंट हैंड वॉशिंग. हाथ अच्छी तरह से धोने का तरीका मैं आपको अभी दिखाता हूं. मेरे हाथ की मूवमेंट की तरफ अच्छी तरह से ध्यान दीजिएगा. हैंड वॉशिंग should be done in a scientific way, which I am going to show you now. Once you apply soap on your hand, the movements of your hand should be in a proper sequence. That sequence is to be remembered. Remember it with a mnemonic I am telling you. सुमन के. सुमन ये कोई भी एक लड़के का नाम है, समझो. SUMAN. ओके, आपने हाथ पे साबुन लगाया है. पहला मूवमेंट है S फॉर सीधा. ओके, S फॉर सीधा, U फॉर उल्टा. ओके, M फॉर मध्यम. ओके, A फॉर अंगूठा, क्लीन योर थंब. N फॉर नाखून, clean your nails. And K for कंगन. कंगन का एरिया भी क्लीन करना है. सुमन के. This movement should go on for at least 20 seconds. And then wash it with liberal tap water, running water. This type of hand washing you must do every 2 hours. That is hand washing. Second is social distancing. आपको एक दूसरे से दूरी रखनी है, कम से कम 1 मीटर. ज्यादा रही तो अच्छा है. उतनी दूरी रखो, so that you may not contract the disease from the other person. That is social distancing. Third important part is face mask. Face mask will cover your mouth and nose. There are three types of masks available. One is cloth mask, second is surgical mask, and third is called respirator, which is popularly आमतौर पर जिसे N95 मास्क कहा जाता है. N95 मास्क ये डॉक्टर्स और नर्सेस के लिए है जो एक्चुअली पेशेंट के कांटेक्ट में आते हैं, उन्होंने वो पहनना है. लास्ट इज हैंड ग्लोव्स. हैंड ग्लोव्स का सबसे महत्व इसलिए है कि जब आप हैंड ग्लोव्स पहनते हो तो आपका हाथ अपने मुंह को, नाक को या आंखों को टच होना अपने आप बंद हो जाता है. सो इसलिए हैंड ग्लोव्स इस्तेमाल करो. नाउ आई एम कमिंग टू द लास्ट पार्ट ऑफ माय टॉक. ये जो भी सब जानकारी मैंने आपको अभी तक दी है उसका आप अपनी पर्सनल, सोशल, प्रोफेशनल लाइफ में कैसे इस्तेमाल करेंगे. फर्स्टली आप सब तो प्रिवेंशन ले लो. दूसरा, यू टेक दिस इंफॉर्मेशन टू योर फैमिली मेंबर्स, योर फ्रेंड्स, टू योर एक्वेंटेंसेस. वो आप हर पेशेंट या पेशेंट के रिश्तेदार जो आपसे आके पूछते हैं उनको दे सकते हैं. दूसरा, एज अ फार्मासिस्ट यू शुड टेक केयर दैट यू विल नॉट गेट infected from the patient who will coming to your shop. Lastly, at your shop, how you will implement this information. First is hand washing, as I told you. So provide a facility for the customers as well for hand washing. I know कि ये practically हर जगह possible नहीं है. Then what to do? Use hand sanitizer. Hand sanitizer रखो हर एक पेशेंट को, हर एक कस्टमर को. बिफोर यू टेक हिज प्रिस्क्रिप्शन, वो प्रिस्क्रिप्शन लेने से पहले उसके हाथ पे हैंड सैनिटाइजर डालो. आप खुद भी अपने हाथ पे हैंड सैनिटाइजर डाल लो और उसका उसी तरह हाथ पे रब करो जैसा मैंने आपको हैंड वॉशिंग के लिए कहा था. ओके, सो हैंड सैनिटाइजर दैट विल टेक केयर ऑफ द हैंड वॉशिंग. सेकंड, सोशल डिस्टेंसिंग. डोंट allow any customer to come near to you. Keep a distance of at least 1 meter. तो आपका जो भी काउंटर है उसके भी आगे एक सीधी सी रस्सी बांध दो ताकि पेशेंट उसके आगे ना आ सके और 1-2 मीटर की दूरी बनाए रखे. आपका हाथ पहुंचेगा 1 मीटर का, उसका हाथ आएगा उधर से 1 मीटर का, बीच में हाथ में मिल हो जाएगा. दैट इज इनफ. गुड. दैट मच सोशल डिस्टेंसिंग इज रिक्वायर्ड. सो डू दैट, ऑब्जर्व दैट. That is face mask. हर आदमी ने घर से बाहर निकलते ही फेस मास्क पहनना अनिवार्य है. ये गवर्नमेंट का रेगुलेशन है. बगैर फेस मास्क के बाहर पड़ना ये आज की तारीख में कानूनी अपराध है दोस्तों. सो आप तो खुद फेस मास्क पहन के रहो, हर वक्त रहो, दुकान पे जब रहोगे, घर से बाहर रहोगे तब. पर आपके पास जो मरीज आता है प्रिस्क्रिप्शन लेके, उसका रिश्तेदार आता है, कोई भी कस्टमर आता है, उसे भी फेस मास्क पहनने पे मजबूर करो. कैसे? यदि कोई कस्टमर आपके पास फेस मास्क बिना फेस मास्क के आता है तो टेल हिम, भाई साहब आप जाओ फेस मास्क पहन के आओ, तब तक मैं आपको दवाइयां देने वाला नहीं हूं. ऐसा आप कर सकते हैं क्योंकि ये वो पेशेंट के, वो आदमी के, आपके, पूरे सोसाइटी के, पूरे इंडिया के लिए सही है, उसके हित में है, इसलिए ऐसा करना अच्छी बात है. ओके. लास्टली, हैंड ग्लोव्स. आप जब भी काउंटर पे हो हैंड ग्लोव्स पहनो और उसके ऊपर से हैंड सैनिटाइजर डालते क्लीन करते रहो. बिटवीन एवरी 2 कस्टमर्स यू मस्ट क्लीन योर हैंड्स. हम सब मिलकर आगे चलेंगे इस कोरोना की युद्ध में, जंग में विजयी होकर आगे चलेंगे. थैंक यू वेरी मच फ्रेंड्स. जय हिंद, जय IIM.
Dr. Ranjan sir, you can answer the questions from the audience. Sir, you have Yeah.
Well, the first question here I have got that it's why the chemist not given security from government. See, I am a private practitioner. All these government guidelines are I am not here to decide about, but the that is like all those who are working in government setup are given security directly. Any chemist or any healthcare worker who is working in government setup, whether it is he is employee of government or whether he has been procured by the state. Like even in this epidemic act, government can give duty like though I am a private practitioner, I may be appointed in a government hospital directly for if my services are required, then I am automatically secured by insurance of central government. That is the position right now. But as a private practitioner working in my own hospital, that security is not there. But same is applied to all the paramedical staff, nurses, ward boys, everybody. If he is working in his private setup, he is not secured. But once he is appointed in the government setup or a setup which is declared as COVID setup by the government, then he is insured. Okay. The another question is a pharma professional could be COVID positive visitors. So all those precautions actually I have narrated in my talk. The second part of the question is when I return back to my residence, what are the precautions? That's a very good question. Once you return back to your house, you should not touch, you should not hug, you should not shake hand with any other family member. You directly go in your bathroom and take a head bath. Discard all the clothes, have a bath, then come out. Hello.
Yeah, we can hear you, sir. Please go on.
Yeah, enhancement of immune system के बारे में एक क्वेश्चन आया है कि there what is to be done to enhance the immune system. आपका रेजिस्टेंस पावर बढ़ाने के लिए you have ample amount of rest. Best is secondly you have good food, good quality food, fresh vegetables, fruits, high protein diet. तो नॉन वेजिटेरियन हो तो उसमें नॉन वेजिटेरियन डाइट में तो प्रोटीन अच्छे रहते हैं, लेकिन दाल वगैरह में भी अच्छी तरह से प्रोटीन आते रहते हैं. Secondly, have ample of water and good amount of rest. I have observed cleanliness. Presence of virus on non-moving object के बारे में लोगों ने पूछा, so it is there. Like what I had told in my lecture कि a case of COVID-19 when coughs or sneezes, that virus goes into droplet and rest on the surfaces. Surfaces like the clothes of that patient, surfaces like his own hands, surfaces like tables, doorknobs, pen, and all this possible things. On plastic, metal, it stays on for longer period of time. On clothes, it is lesser. On hands, it is lesser. But on metal surface and on plastic surface, it lasts or it remains viable. It remains viable for quite a long time. How should chemist counsel buyers of hydroxychloroquine? That is a very good question. As of now, hydroxychloroquine as a prophylaxis is not recommended. It's a very controversial issue. It's a very debatable issue. So, hydroxychloroquine, as recently government has put it in Schedule H drug, so you should not be giving hydroxychloroquine to anybody unless there is a prescription from a registered medical practitioner. In this breath, I will say that the hydroxychloroquine as of today is recommended only for those who are only for those healthcare professionals like doctors and nurses, not all, only those doctors and nurses who are in contact with the active case of COVID-19, who can come into contact with the tracheal secretions of the patient. Like the doctor who is going to do a tracheostomy, who is going to intubate a patient, like that. Then another question is why no such distribution like previously for date cannot provide right facility to our customers. That this facility and the prevention I have talked about in my talk, how to take care, like And remember those simple 4 things: hand washing, social distancing, face mask, and gloves. You should take care of hand washing and social distancing. That will definitely prevent spread or contacting disease from the patient coming to your chemist shop. The next question is, we are taking all the precautions to fight corona, but the main problem is cash transaction. If currency carry coronavirus, how to protect ourselves as it is not possible to sanitize all the time, all the currency? Yes, this is again a very good question, very common apprehension in the society. As of today, the currency notes are not carrying viruses. There is no definite opinion, no definite recommendation that the currency notes carry virus. If at all you are very anxious about that I would suggest you to encourage your patients to pay digitally. Secondly, which is very much common these days, even the roadside food thelawalas are having Paytm and all facilities. Everybody is having Google Pay in his smartphone. So you encourage digital payment. Secondly, if digital payment is not possible, you are forced to take cash, then have those currency notes in a separate box. Let those notes be there in that box for at least 10 to 12 hours, so that if at all there is any possibility of having coronavirus on that note, that gets eliminated. And then after 10 hours or so, you can use that note. To that extent, I will go and tell you that if at all you want to, that you can have those notes, take in a alcohol based rub, spray on that, and then use after 10 to 12 hours. That can be also done. Next question is, hydroxychloroquine recommended as prophylactic to the healthcare professionals in the close contact with COVID-19. Do the retail chemists require any prophylactic treatment, as there is high probability to come in contact with COVID-19 patient? I think I have answered this question in the previous question itself, that hydroxychloroquine, as of today, use of hydroxychloroquine as a prophylactic drug is not unequivocally recommended. It is very much debatable issue, and if at all given, should be given only to doctors and nurses who are in close contact with the active COVID case. Next question is there any method to check at home any symptomatic doubts regarding COVID-19, and what line of action should be taken by an individual if such self-tests increases the doubts? Yes, this is again a very good question. The simple symptoms of COVID are fever, dry cough, running nose, sneezing, body ache, headache. Most importantly, whether you have history of traveling to a corona hotspot, all those areas where corona COVID-19 cases have been common and more found. For example, Mumbai, Pune, Delhi, and initially all those countries like USA, Iran, France, Germany, Italy, these countries. If you have a travel history, then you are bound to get this coronavirus infection more commonly. But if at all you have no such travel history, you have no history of contact with any case, and still you are very anxious that I may get corona, then the symptoms are, as I told you, fever, cough, body ache, dry cough, and sneezing, running nose. Next important thing is you download an Arogya Setu app launched by Minister of Health and Family Welfare. That app has also this self-assessment test given, that you can download that app from the Play Store and get yourself assessed every day. That is a very good app. I would strongly recommend about that. How a supply chain maintained from stockists to retailers and retailers to customer? here a supply chain maintenance, though, because this drug comes under the life-saving services. There is no restriction on movement of drugs or medicines. I think the apprehension or the purpose of this question to me seems that whether that boxes will carry virus and transmit it them. Then again, that those four things, as I mentioned in my talk, are to be observed: hand washing, social distancing, mask and gloves. Herein your gloves will come in more important way to your use, because if you wear gloves by handling those boxes and again you clean the gloves with hand sanitizer, then the chances that you are carrying or propagating the virus are very, very low. Next question is, government is ensuring corona fighters like doctors, sanitation workers, police, nurses, etc. What about so-called corona fighters like us, medical store owners? In this situation, we risk our lives to help patients get their medicine. Absolutely correct. I have started my talk saying that you are warriors in this corona fight. And again, in one of the previous questions, I had told you that the government of India has declared an insurance of up to 50 lakhs. 50 lakhs is for doctors. I think 30 lakhs is for nurses, 20 lakhs for paramedical staff. This insurance gets automatically applied, or you get this insurance cover automatically once you start working in government corona setup. So you need not have to apply, pay any premium, anything like that. The moment you start working, how you start working, it's if you are an employee of government pharmacy, you are automatically covered. And if, again, I reiterate the answer which was given in the previous question, that if your services are procured by the government under the Epidemic Containment and Disaster Management Act, then again this government insurance is applied to you automatically. You don't need to insure yourself, you need to separately, you don't need to register your name separately, you don't need to fill any form, you don't need to pay any premium. This insurance cover gets automatically applied to you. Okay. Is there any possibility of recurrence in the treated patients? How many days isolation will be safe? Yes, in treated patients, currently the protocol in government is they take your throat swab, check twice, and 2 consecutive samples. If turn out to be negative for corona, you are discharged from the hospital. Then you are safe. But considering the history or reports coming from the original source of this infection, that is China, there are chances that there is possibility of recurrence in the treated patients as well. The patients who are treated completely by corona are usually safe once their 2 consecutive swabs come negative. They can come in, they can be discharged from the house. And currently the recommendation is up to 14 days they can secrete the virus from their secretions to a certain extent. After that, they're completely safe for others. How we can care in shop when giving medicine to customer? I have told this in my talk itself, that you keep a safe distance of at least 1 meter from the customer. You observe hand washing, and see to it that you and the customer both are wearing face masks. The next question is, can we sell azithromycin combination freely? Please comment. See, this question is, you can sell azithromycin against a prescription, firstly. Secondly, azithromycin combinations which are approved by FDA. See, in any such situations or epidemic, you must follow laws, the regulations, guidelines set by the Ministry of Health and Family Welfare. Here, if you want to sell a azithromycin combination, it should be against the prescription of a registered medical practitioner. I think that is the only answer I can give to this question categorically. The purpose behind this question may be that azithromycin is supposed to be a drug antibiotic which is used in the treatment of COVID-19 cases. So there is a recommendation that you set aside azithromycin if at all required later for the treatment of patients. So that is why, considering any of the situation, I will strongly recommend you to sell azithromycin singly or even in combination only and only against prescription of a registered medical practitioner. The next question is, I think suppose this is the last question. Every pharma and healthcare professional should be advised to take vitamin C and zinc, and this should be provisioned by respective companies. Yes, zinc and vitamin C are good to boost your immunity. So for giving by giving zinc and vitamin C, you can certainly boost your immunity against any type of disease, including coronavirus. So with consuming vitamin C regularly, maybe 500 milligram 3 times in a day, and zinc gluconate 20 milligram once a day is more than sufficient to have a good, robust, intact immune system, which will prevent you from getting any sort of infection. I think these are the questions. There are no more questions. So thank you very much, friends. Thank you for attending this webinar. I request all of you to spread this message as large to the large population as possible. To fight against this coronavirus, we should be updated on all the information. This information which I have provided to you has been scientific and authentic from very authentic sources. So you can safely pass on this information to all your contacts. And lastly, I thank Juventus Pharma and Science Integra for this webinar. I thank my office bearers of IMA Maharashtra State for associating with this webinar. Thank you very much. Have a great day and stay home, stay safe, take all the precautions and fight corona. Thank you.